12:01 on the dot. So we're gonna go ahead and get started. We could go back one slide. That would be great. All right. So hello, everyone. My name is Katie Powell. I am a well-being consultant here with Care First and also a certified health education specialist with a real passion for health education. I hope you're having a healthy spring season, allergies aside, and I'm so glad you're here with us today. In April, if you were here with us, you know that we had a focus on stress and sleep and that connection. And now that we're in May, we are going to spotlight mental health in recognition of Mental Health Awareness. This month, we'll emphasize the connection between nutrition, sleep, and movement in supporting brain and emotional function. We'll explore signs of anxiety, depression, burnout, and more. And this session will also cover ways to slow down, to reconnect, and reduce stress, especially during our busy season. As always, you should, if you have any specific questions regarding your own mental health, we do recommend you reaching out to your primary care provider, as this presentation is not intended to substitute medical advice. Now, we are all in for such a big treat today. We have the most fabulous guest speaker, Jennifer Shugam, the Director of Behavioral Health here at Care First. She is phenomenal. In this role here, she is responsible for guiding the strategic vision, planning, and execution of behavioral health programs aimed at improving health equity, affordability, quality, and accessibility for all Care First members across Maryland, the District of Columbia, and Northern Virginia. With over 23 years of experience in community psychiatric services and organizational leadership, Jennifer is a dedicated advocate for mental health accessibility and quality, working to build Care First behavioral health offerings. Before coming here to Care First, she served as the executive director of Feeding the People, a nonprofit organization she founded that provided home delivered meals, in-home health education, and support for low-income diabetics in Baltimore. Jen also holds a Master's of Social Work in Clinical Practice with Children and Families from the University of Maryland. And lastly, she is a clinical supervisor for the Maryland Board of Social Work Examiners and is a passionate advocate for destigmatizing mental health issues. So please welcome one of my favorites, Jen Shugam.
Thank you, Katie. That's lovely. So lovely. Good afternoon, everyone. I am looking at the roster here, and we have 430 people, 431 now on the 432 at this webinar today, which is so exciting. So I am here today as the Director of Behavioral Health at Care First, but I am here as an individual. I am here as a working mother. I am here as a parent, and I am here as someone who has lived experience with mental illness and advocacy. And so I am here to talk about what we call the mind maze, which is finding your way through anxiety and depression. We're going to talk about Mental Health Awareness Month. We're going to talk about mental illness. What is it? And some of the questions and some of the leading research that we're seeing right now, as well as the landscape. I'm just curious. I am loving watching this chat because people are doing some amazing things this summer. And I am seeing that folks are hearing an echo. But if you wouldn't mind throwing in the chat, what are some of the things that are giving you stress right now in your life as we're preparing for summer? But when you think about things that you worry about, what kinds of things come to mind? Work, finances. Yep. Yep. Health challenges, work. It's caregiving, cost of food, elder care, work, weddings, death, work, state of the world, cost of gas, economy, children, our health. Yes, I see all of these things. Weight, health, family. I think all of us, and then that's part of the discussion today, we are all dealing with all of these issues. Every person on this call, I'm willing to bet, and there are 460 of us now, are dealing with these issues. And so we're going to talk about some strategies, and we're going to do some good education about mental illness and about the challenges that we're all facing right now and how to look at our own mental health, our own wellness, and to get some strategies for moving forward. So let's go ahead and get started. Um, I cannot see the slides, so I don't know if they're being shared yet, but let's see.
Yep, we're on the foundation of mental health.
Okay, I can't see it. That's my,
That's okay.
there we go. Okay, gotcha. There we are. I can tell you all something that gives me stress is PowerPoint technology sometimes gives me stress. So one of the things, we're going to go ahead and go to the next slide. This is May is Mental Health Awareness Month. Question for you all. When did Mental Health Awareness Month start? Throw in the chat if you know when it started. Take a guess. See if you can go without Googling it. 2020, 1999, 1990, no idea. Yep, honest. Love it. Okay. 1949 was the first, 1950, so we got a 1950 that's close, was the first initiation of Mental Health Awareness Month. And I'm wearing my green today because this is the color for Mental Health Awareness Month. And this started from a gentleman, his last name is Mr. Beers, who was institutionalized. He was mentally ill and he was institutionalized. And he actually started to do advocacy work to come out to destigmatize mental illness and to also bring awareness to the abuses that folks in institutions were suffering. And so there is a long history of this kind of advocacy, and it's evolved over the years, just like everything in our lives evolves. And that's one of the themes we're going to look at today. But over time, the advocacy for mental illness and mental health has evolved. But one of the recurring issues, and we're going to talk about this a lot today, is stigma. And stigma literally means to have a mark on you for having a mental illness or for having a substance use disorder. And May Mental Health Awareness Month is so important because our goal, my goal, and the work that we're doing today is to break down the barriers of stigma and to get folks the help that is needed. So we're going to talk about these things. So when we talk about what is mental health, this is actually looking at the emotional, the psychological, and the social well-being that we have. And this affects how we think, how we feel, and how we act. And when we look at some other treatments later, when we're talking about some strategies, things like cognitive behavioral therapy. These are interventions that actually look at how we think. What we think affects how we feel, and how we feel often impacts how we act. So we're going to look at these things and talk more about it. But I want you to think about this, about your basic wellness. Think, feel, and act. All right, next slide, please. And it changes throughout our lives. When you're a child, you have different needs. You need to be safe. You need to be in an environment that hopefully is predictable. You need to have your primary caregivers supporting you with good nutrition, good opportunities for rest, and productive movement, as well as arts and music and love and all of the things that makes life enjoyable. And that's what our children need. And it changes. If you are a parent, I have kids, I have a 21-year-old and I have an 18-year-old, and I've watched as they've journeyed through life. Adolescents, very different needs at that time. Adolescents also, this is a really difficult thing for parents sometimes. They need that nutrition and that sleep more than ever because they're undergoing such tremendous evolution as a human being. Their entire body is completely morphing them into an adult body, which was prepared for reproduction and all of the secondary characteristics and maturation that's coming online. And so they need good boundaries, good sleep, and they rail against it because they want to be on their phone and they want to be with their friends, which they should, and that's important. But healthy boundaries, consistent boundaries, reinforcing good behaviors, addressing negative behaviors in an appropriate way by the adults and caregivers in their lives, absolutely critical. Young adulthood, again, people going to school, going to work, and the stressors of transitioning from being a young person into adult living, getting a car payment, paying for insurance. There's some of those things that are in there that folks were saying have stressed them out. Learning how to adapt to these things as people age. Again, very, very different phase of life and the needs that people have. But again, consistently and through all these, even through older adulthood, consistent nutrition, consistent sleep, appropriate boundaries, and good self-care is the key to having wellness. I want to talk a little bit about mental illness, but I want to frame it within the context of mental health because every person, every human being has mental health and every human being has struggles. And there is a difference between a struggle and being a human being and having a mental illness. They're not the same thing. So we're going to talk about that. Also, different phases of our lives change how we are affected and how our moods. When you are I can speak to my experience as a mother. When I was pregnant, when I had young children, when I was working and parenting, my stress level was very high often. And I hear from a lot of folks that's the case where you feel like you're trying to juggle a lot of things. And so that can sometimes look like mental illness. Sometimes it is mental illness. And sometimes we figure out ways to cope with that sometimes give us even more issues. 1 in 5 people have a diagnosable mental illness. And the way that diagnoses are the way people are evaluated is there's a book called the Diagnostic and Statistical Manual, and they come out with new versions. This is the abridged version. It's a collection of categories. So it will give a list of symptoms, and the practitioner is trained to evaluate and do an assessment and say, okay, well, over this period of time, how many of these have you experienced? And there's clusters, there's depression, there's anxiety. People that are hearing or seeing things that other people aren't will be evaluated for psychosis. And there's a series of conditions. And then based on that criteria, based on the report of what is shared during the assessment, a diagnosis will be made. One of the things that we are learning in psychiatry, and one of the things that makes it so fascinating and challenging at the same time, is each person has a different experience of their symptoms, and their symptoms may look a different way. And so what looks like insomnia to one person may be someone else's normal sleep schedule. So it's when we're working with individuals, it's very challenging, and it's quite fascinating also to see how things can work with folks. But it's actually only 1 in 5. It's 20% of the population meet diagnostic criteria. At Care First, the bulk of our population, we find is folks that have depression and anxiety are the two primary diagnostic categories that we see. And so if you were to go forth and you were having feelings, one of the things that we say to folks is that, if you're having experiences where you've lost interest in things that you normally like, you're not sleeping, or you're sleeping too much, or you've lost your appetite, or you're eating way more than you normally would. You want to be by yourself. You don't, things that you normally like, you're just not interested in. And that's happening over a period of time. That's what we would say. As Katie said, talk to your primary care provider, or one of the resources that you have here. We actually have an in-house clinical team at Care First. We have a team of licensed master's level clinicians that are available to talk with any Care First member or associate anytime. We do have after hours coverage, but Monday through Friday from 9 to 5, you can call in and talk to our clinical team. And if you have questions about yourself or your family or anyone that's on your policy that you're concerned about, they will help you figure out if treatment is needed and how to access that care. If you don't know where to start and you're not sure where sort of even how to begin to think about it, we are here to help guide you. And that is what our primary responsibility is. So please take advantage of it if you have any concerns whatsoever. And that is for behavioral health and for substance use disorder. Both impact folks. And what we know is that 93% of people that have a substance use disorder never get treatment. That's a huge number. And we are finding more and more that on the medical side, we're seeing that folks are having medical issues that may actually be the result of an undiagnosed substance use disorder. Again, this is the judgment-free zone here. We're here for education and to break down walls, not put them back up. So we're going to talk about what does it look like? What are some kinds of addictions that people are struggling with nowadays, and some solutions for that. So let's see. Next slide, please. So this, the next slide, please. So this is, it's hard to find these pictures, but I look at this and that looks like a normal range of emotion to me. There are days where I'm happy and I'm smiling. There are days where I am just so stressed out and upset and maybe even angry. And then there's days where I'm just meh. And that is a normal thing. When we talk about mental illness, it's really important. And one of the things that every person on this call can do to combat stigma is to not throw labels at people. I love social media. And my kids make fun of me because I like Facebook, and they're like, we don't use Facebook. I use Facebook. But one of the things that I see on Facebook a lot is there are fads. There are fads where you will see different content that people are putting out where in an attempt to educate, we end up putting out labels and having people who are not really in a position to give a diagnosis to someone. I mean, it can be really dangerous to throw those labels around. So I would just, so part of the discussion today is if you have questions, talk to a mental health professional and get clarity for yourself. It can be dangerous, and especially for children and adolescents. And we're going to talk a little bit about that as well today. We want to be real careful that we aren't using labels as a way to address bad behavior, or that we are not using labels to try to punish people, because that just puts folks in a place where they're more afraid to get the help that they need. And that doesn't serve any of us. So we want to talk about that today as well. But this slide, this could be this range of affect, could be mania, it could be depression, it could be postpartum or peripartum depression, it could be anxiety, it could be someone who's struggling with an addiction, perhaps someone who is experiencing grief or trauma. This could be somebody who is going through a life stage right now, perhaps divorce or a separation, or perhaps they're in a caregiving role, or they have a child that has special needs. So it's important to also understand that as a human being, we have a rather large range of emotion that we experience. Where we need to pay attention for ourselves and for those that we love is when we start to see our range get into a place where someone is either saying that they feel unsafe or that they are exhibiting behaviors that are unsafe. So that's what you really want to talk about. And if you don't know, again, and we'll have this information, I'm going to share some resources because I'm looking at the chats. It's the 800 number for behavioral health. Every Care First member on the back of your insurance card, and you take that card, I've got mine sitting right here on my desk. On the back of your card is an 800 number for behavioral health and substance use disorder, and you can call in anytime and talk with our team. All right, next slide, please. So we're going to talk a little bit about anxiety. So anxiety, what are some of the symptoms of anxiety? Insomnia. Sometimes people get shortness in their chest feels tight. Maybe their hands feel, okay, people are putting in racing thoughts, lack of sleep, too much sleep, feeling restless, you're tense, mouth feels dried, hands feel cold and sweaty. A lot of folks will end up in the emergency room with concerns that they're actually having a cardiac event, and it is anxiety. And so we're actually going to do something today. I'm going to teach you all. We're going to do something together called box breathing, and this is to help with anxiety. But anxiety is actually a natural response to stress or perceived danger. It is your body's way of, it's evolution and built into us as a way to try to keep you safe. And it's often described as feeling like fear, feeling afraid, feeling uneasy, uncomfortable, that those kinds of things. Some of the other common symptoms are, heart beating fast, difficulty concentrating, sleep disturbances. Next slide. It can look like some of these things. And some of the severe forms of anxiety are agoraphobia, and that is where people are actually afraid of crowds and going out into public, or panicking, or social anxiety. We see a lot with kids, and a lot of this comes from bullying, cyberbullying, and bullying online, or having access to content that is beyond what they emotionally can maturely handle. Also is called doom scrolling, and I know I've done that, where I'm looking at these uh, these feeds, and it's all kinds of stuff, whatever's coming into your feed, and it can be about any of the things that people have talked about earlier in the chat that make you feel anxiety, so that when you're finished, you just feel you don't feel at peace. Those kinds of things are what can give folks anxiety. Again, there are criteria, and when meeting with a clinician, they will actually go through a series, and then there are protocols. Sometimes folks are prescribed medication depending on the severity, and that can be very helpful. Sometimes it's a question of a particular situation that someone's dealing with at a particular point in their life, and they need some assistance working through it. Sometimes it's a reaction to something that you're having now, that you're experiencing in your life, but it's really about something that you've lived through before, and it's still charged for you. And so sometimes we have reactions to things currently that are sometimes really impacted by things that we've already lived through in our lives. And so these are situations where working with a therapist to work through those things can be really great. Next slide, please. So again, we are in a judgment-free zone here, but there's something really important going on right now in the news with regards to social media. Social media in itself, I'm not judging whether it's good or bad. I love recipes. I love to watch people make delicious meals. I love pugs. I like to listen to new music. I love to see people dance and happy. I love One of my favorite things is when people play music. There's musicians all over the world, and they're playing the same song, and everyone's communicating as human beings through common language of music. I love to see those things. But we're seeing an increase in what are called process addictions. And I'm going to provide some education about that. And these are to using things like smartphones or social media or online gambling. There has been legislation that has impacted social media. And right now in the news, in Massachusetts, there's a court ruling right now that is saying that Meta, which was formerly Facebook, is actually being held responsible for designing a platform that is difficult, that it becomes basically addictive. Legally in the past, and I don't, I'm certainly not a lawyer. Yes, exactly. They've lost in lawsuits on this topic. Historically, they were never held liable because they're not responsible for third-party content or user content. But this case that's in the court now is about the actual design of the platform itself. And the neuroscientists will tell you that the reward system of the brain, social media, gives people, their brains actually respond. And that's why it's really important for children and adolescents to have limited access to this. There is actually a neurochemical process that occurs that creates a feedback reward loop that's intermittent, which is very strong. In other words, the more you do these social medias, the more you want to do them. And what is happening is it's impacting kids' ability to get their sleep. It's affecting how they eat. It's affecting sometimes the social anxiety. Sometimes kids are getting bullied. Sometimes, there's just an intake of content that is disturbing. And, again, as a parent, when I was growing up, we didn't have cell phones. So I didn't deal with any of this when I was young. And so in growing through my life and then becoming a parent and then having to learn how to make decisions about, are we going to use a phone? Are we going to use Facebook? And then when we were in COVID, all of our kids at that time, if you had children, went from being in the school to being online. And so even parents that were really trying to stay on top of this, were really struggling with this, and kids were getting more time on the computer and they weren't moving. They weren't up moving their bodies. When we talk about our breathing, our box breathing later, our breath, the first thing we do when we get anxious is we hold our breath. We stop breathing. And that escalates us. Breathing and moving and eating well and sleeping well. And we're going to talk about a study at Stanford. Those are the things that we all have control over that can help us feel better, even if we have a mental illness, even if we have depression or anxiety, or if we have a severe mental illness like bipolar disorder or schizophrenia. We can improve our symptoms with excellent wellness. And the research is going in that direction. Next slide. So this is just a picture, and I thought this was just a super intense photograph. This is what process addictions, this is kind of what it looks like. It's a cluster in your mind. And this can be gambling. Online gambling, we are seeing a huge increase in young men 18 to 34 because of the deregulation of the federal law for online gambling, where it basically said it's up to the states. And so we are seeing a huge increase in online gambling. And there is a correlation between online gambling for young men between 18 and 34 years old and an increase in suicidality. So this is something that we need to pay attention to. Other areas of process addiction: food, social media, pornography, sex addiction, video games, smartphones. This is in my bed with me all the time. I mean, I never even had one of these growing up. I need my clock. I use this for so many things. It's around. And so these are things that we all are working through right now. Work can also be a process addiction. Next slide, please. So we're going to talk a little bit about depression. So if you have ever seen, let's go to the next slide, because I changed a couple of these things. Put in the chat if you know who this is. Van Gogh. Look at that. Wow. Great job, everybody. That's right. So what is he famous for? I love this chat. You all are such a wonderful, engaged group. That's right. Painting, cutting off his ear. Yep. Cutting off his ear. Yep. That's right. He only lived until his late 20s. I think it was 26 or 27 years old. Depression. He was, he had a mental illness and he also had a substance use disorder. And unfortunately for him, it he got to a place in his life where he actually died of a self-inflicted gunshot wound to the chest. And it's at 37. I thought it was younger than that, but perhaps could be right. I may be remembering incorrectly, and if so, thank you. Um, he actually died of suicide. He shot himself in the chest, and then he died 2 days later. This is what when I look at this, and I love to use art to illustrate feelings and these pictures to illustrate what it looks like. You can see in his eyes. I think you can see in his eyes what the struggle that this person has endured. Depression is one of those things where, again, there are a list of criteria. And in order to be diagnosed, you have to meet 5 of the symptoms, and it has to be for a period of time. Again, but it can look like significant weight loss or gaining weight, too much appetite, no appetite at all, too much sleep, not sleeping at all. We call it psychomotor agitation, having to move excessively or feeling like you can't get out of the chair. Fatigue, loss of energy, feeling low, feeling worthless, feelings of guilt, diminished ability to think or concentrate, feeling indecisive, like can't make decisions. These are, and then also frequent thoughts of death or of suicide. And I am bringing this information to you today because my goal is always to educate everyone about it. If you identify with those symptoms, or you know people that identify with those symptoms, there is always help. I'm on the board of directors for the Baltimore Crisis Response organization in Baltimore, and that is 988. Put in the chat if you've heard of 988 before and what it is. Yes. So 988 is the mental health 911. And this is yes, emergency mental health line. Wonderful, wonderful work. I spent the first 15 years of my journey as a clinician doing home-based psychiatric care in Baltimore. So I worked in the home with folks that had severe chronic mental illness. So folks with schizophrenia, bipolar disorder, severe mental illness. And I've seen the evolution from when I was in the field in the early 2000s, where a clinician would be dispatched with a plainclothes officer. Everything went through 911 to the evolution of 988, where anyone can call in. You can text 988. If you have an issue, 988 is nationwide. That number goes all around. There are local clusters of providers that number routes to on the back end. All you need to do is call 988 and you can text 988. They have 900% more people texting into 988 than calling in. And this is for anything. This is to ask for help. This is if you have an issue that you don't know who to talk to. This is if you have a substance use issue or someone that you love and you don't know what to do. Again, there's help out there. So you've got your 800 number, 988 is reachable. I didn't know that either till I joined their board. And when I heard that, I almost fell out of my chair because I was like, wow, you can text them. They also have mobile treatment units and they will dispatch. If there is a crisis, they will actually go out into the community and work with folks. And I've done that work with those teams for a long time. It is extraordinary work that is going on. So please know if you or anyone that you love needs help, 988. And if you are a Care First associate, 988, or you can call us on the BH helpline and we will help you. Next slide. Let's see. And this is just to illustrate. You can see it. Sometimes you just want to scream. Sometimes you just have your head in your hands, and sometimes you're feeling really low. Again, want to look at things over time and how it's impacting you. If you go through a significant loss or you experience a life event, like if you lose your job or if you lose a relative that you love, or you're going through a traumatic, stressful event, or you've been witness to an event, it's going to affect you. As a human being, our brain, and this is why I love psychiatry so much and why I just think it's so fascinating. For so long, we have thought of psychiatry and medicine as two separate things. Well, guess what? It's all right here. This is my CPU, and my brain is my CPU, and so is yours. Your brain runs the show. Thoughts, feelings, emotions, every process that's going on in your body, everything that's happening in your body and your mind is run by your brain. And it's fascinating because for a long time we thought they were separate things, but they're really not. And that's why the message today is to talk about what do we do? Because just like I need to keep my heart healthy, the things that keep my heart healthy keep my mind healthy, keep my body fit. And it's really, really important that we start to think about it that way. And that as we educate ourselves and each other, we talk about that because it's absolutely the truth. Next slide, please. So sometimes, and I'm gonna skip over this, but just a lot of people, just so that you know, sometimes people have both. They have anxiety and they have depression. And a lot of times they do come over 50% of people have both together. And we're learning more about what causes it. For a long time, the thought was it was a chemical imbalance. I remember when I was trained, that was what the science was saying. We're finding more over time that this is more an impact of metabolism, which impacts inflammation, stress hormones, and there are other things that we just don't know yet. Dopamine is part of it. That's what we're talking about with those addictions, with the reward system. Those are those things that keep you wanting to come back to get more and more of that information, of more of those things like being on your phone or being on social media. But it's important to understand this. So also with comorbidities like heart disease, diabetes, Parkinson's disease, dementia, all of these things have in common that exercise, sleep, rest, stress reduction, joy, and we're going to talk a little bit about some of those things too. Those are the things that you can do to help you feel good. Cortisol, absolutely. We're going to talk about that. So this next slide, this to me is just fascinating. There's a study that came out of Stanford in 2024 looking at diet and the impact of diet on a mental illness. And so what they have found is that, and these are pilots and they're in the research phase right now. But there was a physician out of Harvard, Dr. Chris Palmer, who is a psychiatrist for 20 years, who's really struggled with the ideas about the efficacy of medications and treatments and why some people respond to treatment and then they don't, or how some people are responding to treatment and then it just stops, or and how these things have been confounding for practitioners. Well, one of the things that he found, and it was actually an accident, he was working with one of his patients, and the patient came to him and said he was depressed and he was in treatment for depression and he was also having hallucinations and he was getting divorced and he was single for a while, and he went to the doctor and he said, I think I want to start dating again and I'd like to get in shape. And so the doctor was like, okay, well, that seems like a good goal. Let's work on that together. So they looked at a ketogenic diet. And what they found was that he lost weight, but the symptoms of the hallucinations started to reduce. And he was watching this over time, and this was the first time Dr. Palmer had observed this. And so now they're doing studies out of Stanford. Dr. Sethi, they just wrote a great paper about, it's called ketogenic diet, intervention on metabolic and psychiatric health, and bipolar and schizophrenia. And so there's a lot of work going on right now looking at what is the impact of what we eat. What we know is that refined sugars, highly processed foods, those kinds of things, not fresh fruits and vegetables. The Mediterranean diet consistently shows up in the research as a great way to manage heart health and your weight. And um, and it's lean proteins, fresh fruits and vegetables, and healthy fats. And the ketogenic diet is a low carbohydrate diet where you basically are in a state of ketosis. You need to work with a physician, but just giving you the education, this is some of the leading research that's coming out where they are actually seeing improvements in these symptoms based on diet. And that doesn't mean that they are discontinuing medications, because sometimes one of the side effects that folks have is weight gain. And so that can interfere with people wanting to stay on their medications. They actually can get metabolic syndrome from some of the medications. And so they're using the medications and the ketogenic diet in concert, and they're seeing great results for people. In this pilot study, on average, the participants lost 10% of their body weight. They reduced their circumference of their waist by 11%. They had lower blood pressure, lower body mass index, lower triglycerides, lower blood sugar levels, and lowered insulin resistance. So very, very interesting. But it just gets back to the point that we have to look at the whole being. We have to look at our entire being, and that includes what we eat and how we sleep in addition, and that does impact our mental health. So let's get into some of these tools, because we're getting close to time. So what do we have? Treatment options here. There's so many different things. You don't have to pick for yourself. If you have questions or concerns, or you want to get more information, call into the 800 number on the back of your card. We will talk to you. Call 988. They can talk to you. But there's therapy, and there's all kinds of therapy. Therapy geared to look at your thoughts, your feelings, which impacts your behaviors. There's in this upper right-hand corner, this is called magnetic stimulation, which is magnets. Our brain is an electrical storm, and they are using magnets as ways to try to redirect currents so that they can help. It's a form of trauma therapy, and also for anxiety and depression without side effects. They're looking at psychedelics now, and this research has been going on for a very long time, but it's become more mainstream. But there's actually clinical trials that have been going on at Shepherd, Pratt and Hopkins in the area for some time, where they're studying the impacts of psychedelics in controlled settings, administered by a team, a psychiatrist and a therapist, male and female, in what's this bottom right-hand room. They call them trip rooms, and they actually are working through that with people. And again, they're studying the efficacy of these treatments. But the point is, there are just a lot of different ways to come at this. There are natural supplements. Saffron is a huge one that they're looking at, where they have seen tremendous impact for supplements. Dr. Amen, who is a psychiatrist, and he's all over social media, but a lot of what Care First does cover these treatments. We do cover TMS, we do cover therapy, we do cover medication. If you have benefit questions, call into our CSA or call, and they can tell you exactly, because it depends on your specific policy. But there are a lot of different ways to come at this. And so this is just to give you some of that information. The next thing, next slide. This is actually came out of the University of Pennsylvania, PERMA. This is what is considered the equation for happiness. And it says that if you have these 5 things going on in a day, you can feel happy, which is really interesting. And they are positive emotions, looking at the things in your life that you feel good about, the things that you feel gratitude for. Engagement. What do you like to do? What do you like to do? I love to garden. I'm not really good at it, but I do like it. what is it that you're into with your community or your family or your friends? I love to dance. I love to listen to music. I love to see live music. It doesn't matter what it is. I will go to a show and listen. I love it. Relationships, and these are positive relationships, not dramatic ones that give you stress, but good, supportive, healthy relationships with healthy boundaries where you can be honest and they can be honest, and you can have support and respect. Meaning, what in your life gives you meaning? What makes you think when you do something that it's important? For me, you know, peace. And is it I like the golden rule. That's how I look at something. Is what I'm doing good for the world the way it would be good for me? And that is why I love the clinical work, and that's why I love the work that I do, is because I am here to be of service to other people. It means something to me. And it's hard. I mean, it's been a hard, it's hard work sometimes. And anyone that's in a profession, it's hard. But why do you do what you do? And then finally, what is your achievement? What is your goal? What do you want to accomplish? Do you want to get a degree? Do you want to be, do you have a personal goal that you're into, working towards something? If you can get these five things together, this is part of the positive psychology movement out of University of Pennsylvania. It's called PERMA. And these are the things and there's more information available. Google PERMA and you can pull it up. Volunteering, absolutely. Adopt an animal and a shelter animal. Yes, mine's on the floor right here. Walter, he's my foster fail. Meditating, spending out time outside. Go outside and take your shoes off. Stand in the grass. Everything is charged with positive energy and negative energy. That's physics. That's the world we live in, folks. You can go outside and stand in the grass and you will experience the benefits of grounding by standing in the grass with no shoes on. Now, 20 years ago, if somebody said that, they'd say that doesn't sound right. The science is true, is there. It is absolutely a very real thing. There are gradients, there are energy gradients. If you're having a hard day, you go outside, take your shoes off, and you're gonna, yes, hug a tree always. Next slide. Sleep. Please hear me when I say this. If you have a TV on, turn it off in your room. Turn the lights out in your room if you can, if you're comfortable, if you feel safe that way. If you need a light on because you feel safe, that's okay too. But you really want to try to have a dark room because your brain is always looking for light. There's a gland in your mind that is always looking for light. And so it can distract you and wake you up. Children in bed with a television on, it keeps them awake. It might help them fall asleep. If you need something to help you fall asleep, put a fan on. There's white noise apps. If you go onto YouTube, they have there's all kinds of white noise and ambient music, binaural beats. There's so many things that you can put on that will help you rest. But turn the phone on its face down so that the light's not waking you up. Next, physical activity. This is all of us right here. We are bone, we are muscle, we are ligaments, we are fascia, we are skin, we are human beings. We have got to move these bodies. We got to move them. If you can't do anything other than to get up and take a walk, take a walk. That's something. A lot of people still holds true. Try to get your 10,000 steps a day. It's hard. A lot of times I'm at 4. I feel like I've walked 10,000 and I look at my Fitbit and I got 4,700 4,700 steps. So I got to focus my mind. I like the elliptical machine and I'm in my 50s now and I love to lift weights. I'm an old college athlete and I didn't know that I would love it again, but I do. And I've started lifting weights and it's really been wonderful. Talk to your doctor, talk to your wellness team. Katie Powell's here. They will help you. Just a couple quick things. We talked about diet, substances. I want to show you just some quick pictures and then we're going to wrap it up. This is a no judgment zone. Okay. We're back to the no judgment zone. Alcohol is legal. Cannabis is legal. No judgment from Jennifer. I'm not here to judge anybody. But what I can tell you, next picture. This is what a healthy brain looks like. This is a SPECT scan. SPECT scan measures blood flow. They give people a little bit of dye and it looks at neural activity and blood flow of your brain. So when your brain is healthy, it looks kind of like this on a SPECT scan. Next slide, please. This is what your brain looks like with addictions, with alcohol, cocaine, and marijuana. this is really important because you can't see inside your head, and I love kids tell me you can't see your thinks. I can't see my thinks. These are brains. And the Amen Clinic has hundreds of thousands of scans that show the same patterns over and over again of what these things do to our brain. Again, judgment free zone, not here. I'm not here to judge anybody. I'm giving you education. Think about it. Think about how you feel. If you're struggling, and you maybe are using something and it's giving you trouble or it's giving you difficulty or you have questions, you can call into our 800 number. And guess what? On that 800 number, on option 2, we have a vendor or a partner that we work with, Navigator Health. You can call Navigator Health on our phone tree 365 24/7 and talk with a licensed clinician, and they will schedule real-time substance use disorder treatment for you. We can get you in within 24 to 48 hours with an in-network clinician. Just so you know, for CareFirst commercial line of business, 5 times higher rate of alcohol use disorder than any of the other substances. Again, no judgment here. If you need help or you're struggling, we can help. There are 12-step recovery programs. You can go online and find a Zoom meeting. When COVID happened, the 12-step recovery programs for Narcotics Anonymous, Alcoholics Anonymous, Overeaters, you name it, everything went online. And so now there are hybrid meetings where people can't necessarily get into an in-person meeting, but they can go online and get into recovery. That is out there for you. Next slide, please. We're running out of time here. We'll put this in the chat. Navigator Health, and they are on our phone tree. So if you call that 800 number on the back of your card, they're option 2 on the behavioral health line, and you can talk with them. If you have questions, call them. If you want to get scheduled, give them a call. It's confidential. It is private and it is confidential. Please get the help that if you need it. These are our programs for CareFirst. We've got care management. So we've got our team of clinicians that can support you. We've got our substance use disorder program. We've got network enhancements that we're working with. We have digital providers. You can see virtual providers for therapy or medication management. We have a lot of access. We can get you in. Most of these appointments, 5 days to care. From when you sign up to when you get in is 5 days. We have online eating disorder treatment. If you don't know where to go again, or you have questions, you let us know. We also have a high-risk maternity program. This is for pregnant women that are maybe have a behavioral health or substance use disorder. We have practitioners that work specifically to make sure that pregnant people get the care they need. No judgment, behavioral health or substance use disorder. And then we're also doing follow-up with these individuals to make sure that they are getting the treatment they need. We also have a webinar library. We have amazing providers in our CareFirst network, and our behavioral health division has webinars. We go out to the best providers and we ask them to teach, and anyone can come to these teachings. And if you're a clinician and you're working on your license, you can get free CEU credits for that as well. So I'm really excited to bring that work forward. That's what our team's been working on in behavioral health. We are here to serve you. Katie, I don't know, do we have time for box breathing? If we don't, I can tell you what it is in 30 seconds or less. And if you have, I'll do that. How about that, Katie? Because I know
That
you've
works.
got things to show. Box breathing, real simple. Navy SEALs use it. And this is a way to decrease your anxiety. You're going to breathe in for 4 seconds. You're going to hold your breath for 4 seconds. You're going to exhale for 4 seconds. And you're going to hold it. You're going to hold again for 4 seconds. And you're going to go 4. So you always know it's 4. Inhale 4, hold 4, exhale 4, hold 4. 5 minutes. This engages your parasympathetic nerve system. This will decrease your anxiety. So when we get anxious or we get worried or we have an issue, remember to breathe. I got really excited and I went over, and I'm sorry. I love this stuff. I want to give gracious thanks to all of you for dialing in today. I am wishing you all the very best of excellent health and joy in your lives. And if you have questions, again, you give us a call anytime. We are here to serve you. Thank you so much. Katie, back to you.
You're amazing. It was perfect. I have so much to say, but in general, just like Jen said, it's the whole body, right? Mental health is not just, mental health. It's also things like getting enough sleep, eating healthy, being physically active, breathing, paying attention to your breathing. We had so many questions and comments in the chat. I think one of the biggest ones is yes, you will get a recording of this presentation. You will get the slide deck as well. It takes us usually about 7 to 10 days to get everything together and approved and sent out. So please be on the lookout for that. For anyone who was, stating that they are feeling a certain way, utilize the resources that Jen had shared. If you need help, there's no better time than right this moment. We will continue our Wellness Wednesday webinars. In June, we will talk about brain health and healthy aging, and then July will be more about summer safety. Next slide is just our resources. Again, this will be in the recording as well as the slide deck, but Care First Wellbeing is your go-to solution for everything health and wellness, especially when we think about our mental health well-being, reducing stress, anxiety, depression, etc. We have two great resources for you. One is inspirations that can help with the lower level acuity, such as sleep relaxation, yoga classes, exercise. And then we also have Unwinding as one of our core programs that really helps you understand the brain, how it works, why it's working, and provide you some top tier solutions. This is a more medium acuity care. And then, of course, we have what Jen said, those behavioral health care lines that can be accessed any day and any time. As always, we also have additional Care First resources. We like to wrap our arms around our members and let you know how much we love and support you and want to provide as much as we can in terms of resources. So we have the preventative care checklist, a very robust health library, and then care management programs. At the end, a survey will pop up. Please take a moment to fill it out. Thank you so much for sticking with us. We wish you a happy and healthy mental health month. Thank you all so much.